Technically, the term osteomyelitis should indicate inflammation of the bone and bone marrow. See, osteo means bone, myelo means bone marrow, and itis means inflammation. So technically, osteomyelitis should mean inflammation of the bone and bone marrow. But in clinical practice, the term osteomyelitis definitely in 99% of the cases indicates infection of the bone and bone marrow, not your sterile inflammation. Definitely there is going to be there inflammation, but that inflammation is due to bacterial infection, that is not a sterile inflammatory process. So osteomyelitis is infection of your bone and bone marrow. Now how can this infection occur? There are three routes from which a bone marrow can get infected. First route is through your blood, hematogenous spread. Second route is from the neighboring structures. What could be the neighboring structures? Most common example is your diabetic foot. Third is direct invasion of the bacteria to the bone. This happens whenever there is an open fracture. The bone is directly exposed to the surrounding environment, or when there is any penetrating injury which is penetrating the bone also, that can cause your direct infection of the bone. Also many times surgery could be a cause of osteomyelitis. So the three modes I have discussed, through blood, through the neighboring structures, and direct infection. Now coming to how the bone gets infected by the blood. See, in children, the most common bone that gets infected are your long bones, and particularly the metaphysis of the long bones. That is because the metaphysis are growing parts of the long bone. They get a lot of blood supply, and because of the extra blood supply, and there is also a lot of stasis of blood in the metaphysis region, this makes the metaphysis prone to develop infections. Whereas in adults, most of the adult osteomyelitis is in the lumbar vertebra. So remember this always. In children, the site of osteomyelitis is commonly the long bones. In adults, the site of osteomyelitis is most commonly your lumbar vertebra. This is what you need to remember for your exam.